Hi class. I'm going to do kind of a quick overview of chapters 13 and 14. So just be aware this is not as extensive of a video as the ones before. At least that's not my intention, so we'll see how well I do that. So the first chapter we're looking at, chapter 13, is over the ear. And the ear can be kind of complicated, so definitely look through the anatomy, make sure that you are understanding um, how the ear functions as well as the terminology. You don't necessarily have to know too much detail. Whenever you pull up your PowerPoint, make sure that you're going to these YouTube videos to watch them because they are informative and they will kind of show you what the structure of the ear is like. So there are two functions of the ear, which are to hear and to give you a sense of balance. There are three parts to the ear: the external, the middle, and the inner ears. The inner ear is also called the labyrinth, and we'll see why that's called that way in just a little bit. Sometimes we hear or we hear sound waves because of the fact that the ear vibrates. The waves vibrate and then turn, they cause the eardrum to vibrate. And that's where the vibrations are transformed into nerve impulses that are then carried to the brain and let us know what we're hearing. So this figure should be in your book. It is the anatomy of the ear. And in my book, it is right above or right next to organs and anatomic structures of the ear. And then also next to this figure, you will see another figure that's kind of a progression chart of how sound travels from the ear to the brain. So as you can see, there is the external ear, the middle ear, and the inner ear. The reason that we call the inner ear the labyrinth is because the cochlea, the vestibule, the semicircular canals, they kind of resemble a maze or a labyrinth, and so that's why we typically call it that. That's another name for it. The eustachian tube, if you've ever heard anybody say that they had to get tubes put in their ears, this is where the tubes go in. A lot of times they have issues with drainage, which causes them to have a lot of ear infections. And so this allows the patient to be rid of the extra fluid, which causes less ear infections. So your auricle, this is your ear, the external part of your ear, and then your earlobe right down here, and then your external auditory meatus. In radiology, we use the EAM or the external auditory meatus or canal for positioning of skull and facial x-rays. It's an external landmark that we use to kind of align the skull in an anatomical position. And these middle ear structures, the tympanic membrane, the incus, the stapes, and the malleus, this is actually where the waves, the sound waves travel to initially, and that's where all of the vibrations begin. So the external ear is on both sides of the head. The auricle or the pinna is that outside top part of your earlobe. And then the external auditory meatus, or EAM for short, is how we use it in radiology. It's a short tube that extends from the external part of the ear to the tympanic membrane. And that's what we typically will clean out when you use Q-tips, which you're not supposed to use, but some people still use them. I don't like to use Q-tips because I'm always afraid I'm going to pop my eardrum because it feels really good when you sit there and you start to clean your ear out, and that can be really dangerous. So your middle ear has your tympanic membrane. That is the eardrum. That is what is helping to actually transfer those vibrations to the inner ear. And then your eustachian tube, like I said, that connects the ear and the pharynx. So that drainage that you have whenever you're sick, it does extend down into your throat. And if you don't have very good drainage, it can cause you to have infections. And then the ossicles are the bones of the middle ear, and that's what carry the vibrations or the sound vibrations. So here's a more blown up view of the middle ear, the tympanic membrane or the eardrum. They call it that because it literally, when you watch it and see it working, it actually vibrates like a drum would vibrate when you hit it with your hand or with the snare or whatever you have on your hands that you can hit with. I don't play drums clearly, so I don't know the names of the equipment, but this is what the eardrum looks like in real life. It is a thin membrane just like it says, and it's taut, it's very tight, it's pulled very taut, and so it tends to vibrate every time a sound wave hits it, and that's how we hear things. So the inner ear, or the labyrinth, as we call it, contains the cochlea, the semicircular canals and vestibule, and the mastoid bone and cells. The cochlea is that snail-shaped figure that we saw at the beginning, and that's also in your book. That is where the organ of hearing is. It connects to the oval window in the middle ear. Your semicircular canals and your vestibule, they have receptors and endolymph that help the body maintain its balance. Endolymph is an interesting term. It is a combination of endocrine and lymphatic. And so it is a type of fluid that you have within your ear, and that helps maintain your balance. So sometimes if you get a little bit of vertigo, or if you're sick, especially if you have like a cold or a flu or something like that, you actually will feel a little dizzy because of the fact that there's a little extra fluid in your ears because the drainage is not working properly. And that fluid interferes with the endolymph and its job of maintaining your balance. And so things kind of go out of whack. And then your mastoid bone and cells, those are in the skull, and they're right behind the external auditory meatus. If you reach behind your ear, there's that hard piece of skull that's right behind your ear. It kind of sticks out a little bit. That is what your mastoid bone is. And that actually is part of where your ear structures are. So, of course, if you have an injury and that part of your head is hit, you might lose your hearing. So this is the view, or the figure that should be in your book. It does have the progression of the sound waves. So initially they go through the auricle to the external auditory canal, through to the tympanic membrane right here. So from out here, in through here, hits the tympanic membrane, it starts to vibrate. Those vibrations will go into the middle ear where the ossicles, which are the malleus, the incus, and the stapes, they will also have a little bit of vibration as well. And they have the receptors, and that reaches into the oval window, the cochlea, and then the cochlea reaches into the acoustic nerve, or the cranial nerve 8. This is also called acoustic nerve. And that will lead to the brain, the temporal lobe of your brain. Temporal is where your temple is. So your temporal lobe is going to be right where your temple is, on either side of your head. And that is where your brain processes sounds. So let's look at some combining forms, and these are in your book as well. You definitely are going to have a lot of different combining forms for both of these chapters. So of course, like always, make sure that you are studying them. This picture is actually parts of the ear of a human being's ear, a cadaver. And so I'm not exactly sure what these are right here. I don't recall putting this picture on here, but this is what it looks like. They're actually very small. This is a very blown up picture. So audio is hearing. Oreo, or ori, and auto, oro, those are all combining forms for the ear itself. Cochleo is the cochlea. Labyrintho, obviously, the labyrinth. Mastoido is the mastoid bone itself. And I think this is part of the mastoid bone right here, but it is not the entire mastoid bone. Myringo is the tympanic membrane, or the eardrum. Stapido is stapes. Tympano is the middle ear, and vestibulo is the vestibule. So if you want to look at this and review yourself over these images, this should be in your book. These are the combining forms that we just went over. So which of these is the combining form for the eardrum? Would it be myringo, stapido, or audio? Well, we know that the eardrum, or the tympanic membrane, is myringo, so it is A. Stapido, as we just said, is the stapes. And then audio is for hearing, so it's the combining form for just general hearing. So typically, tympano is your middle ear. Labyrintho is going to be your inner ear, and myringo is going to be your eardrum. So just remember. Another way to remember tympano for your middle ear, think of like tympanic or timpani, which is all related to drumming. And that is where your eardrum is in your middle ear. And then labyrintho, remember I said that the reason we call it the labyrinth is because it looks like a maze. Well, that's where your cochlea is positioned, is in the inner ear. So always know that anything related to labyrintho is the inner ear. So there are going to be a lot of word parts in this, terms in this chapter related to word parts. Labyrinthitis, obviously inflammation of the labyrinth. Mastoiditis is inflammation of the mastoid bone. Myringitis is inflammation of the tympanic membrane or the eardrum. Otalgia is pain in the ear. Osteomastoiditis is inflammation of the ear and the mastoid bone. Automycosis is the abnormal condition of fungus in the ear, and this typically will affect the external auditory canal. This is the fungus right here, and this is just right inside the ear. I mean, they're not going in very deep. They're just looking with a little camera, and as you can see, all this black is actually fungus within the ear. Autopyorrhea, we know rhea is discharge or flow, and pyo, we know pyo is the pus, like that's the combining form for pus. So this picture right here is showing the abnormal discharge of pus from the ear, which is not good. We don't want this. It kind of looks like it would be wax, but it's not wax. And then otosclerosis is the hardening of the ear or the stapes, which is caused by irregular bone development and that results in hearing loss. Remember, sclerosis is hardening. So anything that has to do with hardening of the ear is going to cause a lack of function. Remember, all of the parts of the ear are vibrating parts. They are moving. They're very light and airy, and they do tend to vibrate with the sound waves. So if we have a hardening of those parts, naturally you're going to have less vibration, and naturally that's going to lead to hearing loss because you won't be able to get those sound waves to the nerves. So some diseases associated with the ear that are not built from word parts: acoustic neuroma, cholesteatoma, Meniere's disease, otitis externa, otitis media, presbycusis, tinnitus, and vertigo. Make sure you look at the book and find out which of these, what their definitions are. Cholesteatoma is a cyst-like mass of epithelial cells and cholesterol, which is kind of interesting. Meniere's disease is a chronic disease that pretty much causes you to have constant dizziness or vertigo. You start to get a lot of ringing in your ear. You feel like there's a lot of fullness in your ear. And then sometimes you might have some hearing loss. And then these are symptoms that are caused due to the changes in the composition and the amount of fluid that is in the labyrinth of the ear. Remember, the labyrinth is in the inner ear. That is where our balance comes from, is our inner ear. So if you have an inner ear infection, you'll typically have issues with balance. Vertigo itself is a sense that you're losing your own balance, that you're spinning. A lot of times it feels like you're spinning, and it can cause a lot of nausea for people because it's not very comfortable. So try to go through this. I'm not quite sure what this word is. I did not create this PowerPoint, and I've been trying to figure this out. So if any of you know what this word is, let me know. It says, although the distance held to read the newspaper might make you think of presbyopia, aging also brings this along. Too many years of loud music might just cause this. Obviously, it has to do with hearing loss, so let me know what you think. So there are a lot of surgical terms associated with the ear, not as much as some of the other parts of the body, but definitely enough to make you never want to have ear surgery. Cochlear implants, this is something that we deal with in radiology. People who have a cochlear implant will have an implant within the ear, and also that it extends into the ear, and it also sits right on the outside of the brain, right outside the skull. And there's a headpiece that's attached to the outside part of the head. So you have a piece that is attached to the external part of your head, something implanted into your head, and then a lead that extends down into the cochlea. And this allows people to hear. This is a hearing aid kind of contraption that will sit over their ear, and then it will sit right inside of their external auditory meatus, like right at the opening. And that allows their ear to channel the waves from outside into the cochlea. and that is how they are able to hear. In radiology, people who have this can't have very many exams, especially in MRI, so we have to be very careful. Labyrinthectomy, that's obviously the removal of the labyrinth. Mastoidectomy, mastoidotomy, know the difference between these two. Myringeoplasty, myringotomy, stapedectomy, and tympanoplasty. So this is acute otitis media, and this is a normal tympanic membrane. As you can see, otitis is obviously related to inflammation. So it's red, it's inflamed, and therefore it's not going to work very well. This is what your tympanic membrane looks like. This is, see how thin it is? You can kind of see through it. This is that eardrum that we're talking about. It's very thin, and so that vibration comes right through it. But when it's inflamed, it doesn't look as thin. It looks kind of swollen, and so hearing is not as feasible. So a myringotomy, as you can see, they're going in and they're removing or opening a hole in the tympanic membrane, which allows them to clear out whatever pus is in there causing the inflammation and allows for the membrane to function normally. This little contraption right here is something that they seal it off with so that it doesn't stay open, of course. So these are some diagnostic terms. This is how we diagnose the types of issues that might occur in the ear: an audiogram, audiometer, audiometry, electrocochleography, otoscope, otoscopy, tympanometer, and tympanometry. This is an audiometer, and this is the audiogram that is created from the audiometer. There are a lot of other complementary terms. Obviously, an audiologist is somebody who is studying and specializing in hearing. Audiology is the study of hearing. Oral is pertaining to the ear. Notice how it's not spelled with an O, but with an AU, but ORAL is obviously pertaining to the mouth. Oral is pertaining to the ear. Cochlear, otologist, otology, otolaryngologist, vestibular, and vestibulocochlear. So make sure you're going through this PowerPoint as you're going through the chapter, that you're going through your abbreviations. Actually, let's go back to the abbreviations. There's not that many. AOM is acute otitis media. That is inflammation of your middle ear. ENT is ear, nose, and throat. That is an abbreviation for an otolaryngologist or a doctor that specializes in the ears, nose, and throat. So if you're having any issues with those areas, you will go see an ENT as a specialist, especially if you're needing to have surgery. HOH is hard of hearing, and OM is otitis media or your middle ear. So let's read this real quick. The acute otitis media is one of the most common pediatric infections. Most middle ear infections are caused by bacteria and some by viruses. Symptoms include otalgia, otorrhea, ear pulling, and irritability. Otalgia, that is pain in the ear. Otorrhea or otorrhea is discharge from the ear. Ear pulling and irritability. If any of you have had an ear infection, as I have, I've had many, unfortunately. Ear pulling sometimes feels like it's helping because what you're doing is kind of extending that ear out and making everything kind of move around, but unfortunately it doesn't help. The tympanic membrane will be bulging, red in color with a thickened appearance and reduced translucency. Remember how I was talking earlier about the image of the normal and the inflamed tympanic membrane or the eardrum? When it's thickened and you don't see as much translucency, it's not very see-through, then you're also reducing its ability to function. And it's thickened because it most likely has a lot of pus collection due to the inflammation. It's red in color because of the inflammation. It's red in color because of the inflammation. I'm saying that twice because you have to understand what inflammation does. When you have any area in your body where there is inflammation because of an injury or because of a disease or a disease process, the reason that it turns red is because your blood cells are rushing to that area, because there are a lot of different types of blood cells that we have that help to take care of inflammation. And so it's red in color because blood flows more intensely to that area. So antibiotics may be ordered if the infection does not resolve on its own. I don't necessarily recommend waiting to let the infection resolve on its own. The last thing that you want to do when it comes to your ear is allow the infection to get so bad that you lose your hearing. So if you have an ear infection, clearly I suggest you go to the doctor. Or if you have some homeopathic remedies, I believe in homeopathic remedies. Homeopathy is a very underused and undervalued way of treatment. It worked for our ancestors for hundreds of years, and chemicals in the body sometimes are helpful, but not all the time. So if unresponsive to antibiotic treatment, a myringotomy may be performed to identify the causative pathogen, allowing for the appropriate antibiotic treatment to be prescribed. So what they're going to do if they see that the antibiotics don't work, they're going to go in, they're going to do an otomy or an opening, a cut into the tympanic membrane, and to see possibly if they can clear out some of the pus, or if they can see, they'll probably take some samples and run some tests and see what's actually causing the infection. So that is the end of chapter